Today marks World AIDS Day, and UN Secretary General Ban Ki-moon has taken the time and the opportunity to call for more global commitment to combating the epidemic. He's also appealed for tolerance, saying vulnerable groups deserve protection from stigma and abuse. The UN chief has urged nations to continue their efforts to meet the goal of getting 30 million patients HIV/AIDS treatment by 2030.
We are motivated to fight AIDS because we know that every child deserves a care, every person deserves a treatment, and all vulnerable groups deserve protection from stigma and abuse. We know that hatred and bigotry spread disease, and as the founders of this movement taught, silence equals death.
Well, let's bring you more now from the UN headquarters. CCTV's Nick Harper joins us live from New York. Of course, Nick, last year, world leaders unanimously committed to ending the AIDS epidemic by 2030. This, of course, as part of the UN's Sustainable Development Goals. Now, as the world marks World AIDS Day, is there a sense at the UN that we're on course to achieving this goal?
Well, it's certainly something that's come up on many occasions over the last couple of days. The Secretary-General, Ban Ki-moon, has made several speeches, and he's come back to this idea time and again that there should be pride about the results that have been achieved over the last few years, but there's also this need to look forward to what still needs to be done. The United Nations says that it has made considerable progress in fighting HIV and AIDS. For example, between 2001 and 2013, new infection rates dropped by 38%, but those sustainable development goals are very ambitious. By 2030, they want there to be no new infections, no AIDS-related deaths, and no discrimination for people who are living with the virus. And Ban Ki-moon, over the last few days, has also spoken about this need to fast-track more patients onto medication. So by 2030, he wants 30 million people to be in treatment. So they want to hit those targets. They feel that they can achieve those targets, but perhaps with 13 years still to go, it's a little bit too early to know whether or not they are on track. But they have talked about the considerable progress that has so far at least been made.
And as you say, those are very ambitious goals, and we know that Africa bears a large burden when it comes to the HIV/AIDS epidemic. What has emerged this year from World AIDS Day events regarding Africa's fight against the virus?
Well, Africa is the continent that has been spoken about time and again, about the place that efforts need to be redoubled, that there is plenty of good work going on the African continent, but essentially UN aid workers need to achieve even more progress if they're to hit those 2030 goals. For example, the fact that in sub-Saharan Africa, young women are 14 times more likely to contract HIV than young men. We also know that in Africa, AIDS is now the #1 cause of death. And the fact that we are seeing some progress. For example, the United Nations are saying that over the last 6 years, new infections among children in 21 sub-Saharan countries has dropped by about 60%. But Ban Ki-moon is saying that if the United Nations is to reach those sustainable development goals by 2030, they must absolutely reach all of the vulnerable communities, and that includes all of the people on the African continent, in particular those young girls in sub-Saharan Africa. So they are saying they've achieved a lot, they've done good work, but much more work is still needed to be done on the African continent.
Indeed, plenty of work to be done. Thanks very much to Nick Harper there, live for us from New York.